In this video, let us learn the different position of vermiform appendix. You know, the vermiform appendix is placed in the right iliac fossa. And here in this diagram, we are seeing the cecum, and this is the ilium. You know, the vermiform appendix is a narrow worm-like diverticulum which arising from the posteromedial aspect of the cecum 2 cm below the iliocecal junction. So base of the appendix, this is the base of the appendix and it has got an apex. Base is fixed and the apex of the appendix, vermiform appendix, directed towards any direction. Okay, so based on the direction of the apex of the vermiform appendix, there are different types of appendix or different positions of the appendix. So let us learn what are the different position of vermiform appendix. Okay, and the first one is the paracolic position. Paracolic position. Okay, and this different position of the vermiform appendix is compared to the hand of a clock, like 11 o'clock, 12 o'clock position, 2 o'clock position, 3 o'clock, 4 o'clock and 6 o'clock positions. Starts with the first position, that is a paracolic. From the name itself we can see paracolic means parallel to colon. I told you this is the cecum and ascending colon, and the paracolic position means the vermiform appendix passes upwards onto the right side of ascending colon, upwards onto the right side of ascending colon, and such type of paracolic vermiform appendix present in 2% of the subject. Next position is retrocecal position, means the vermiform appendix runs upwards behind the cecum and ascending colon. It lies behind the cecum and ascending colon. It is present in 65.2% of the subject. That retrocecal is the commonest position of vermiform appendix. Now, next is the splenic type. Splenic type. You know, paracolic position is 11 o'clock position. Retrocecal is running upwards, so it is 12 o'clock position. And the next is a 2 o'clock position. It is known as the splenic. That is the direction, tip of the vermiform appendix is towards the spleen. Okay, you know, spleen is present in the left hypochondrium. Okay, so this is the splenic type. There are two subtypes are there. The one which runs in front of this ilium, that is known as a pre-ileal, and the other one which lies behind the ilium, that is known as the post-ileal. So this is the pre-ileal type and the post-ileal. Pre-ileal type is present in 1% of the subject and the post-ileal present in 0.4% of subject. These two constitute the 2 o'clock position. Now, next one is a promontoric type or the 3 o'clock position. Okay, promontoric means it is directed toward a sacral promontory. You know sacral promontory. Sacral promontory is the prominent anterior border of the first sacral vertebra. Okay, so this 3 o'clock position is the promontoric type and it is present in 1% of the subject. Next one is pelvic or 4 o'clock position. So here the vermiform appendix descends downwards and medially, crosses a pelvic brim and enter into the true pelvis. In females, it may be related to the right uterine tube. It is the second commonest position of vermiform appendix. Pelvic type is the second commonest type and normally present in 31.01% of the subject. And the last one is 6 o'clock position or the midinguinal position. Here, the vermiform appendix, you know, it is running vertically downwards and point towards the inguinal ligament. Okay, it is present in 2% of the subject and it is the 6 o'clock position. Okay, so this is the different position of vermiform appendix. Now you know the cecum and the vermiform appendix lies in the right iliac fossa. Okay, so behind the cecum there is a muscle, you know, that is the psoas major muscle. There is a psoas major muscle. Okay, so what happens when the vermiform appendix is retrocecal in position? It lies on the psoas major muscle. Okay, so the forced extension of the right thigh. Okay, the forced extension of the right thigh in such patients causes increased pain in the right iliac fossa. and that test is known as a SWAS test. Normally, this test is done in clinical setup, SWAS test.